And that work is made possible through the efforts of people who did not choose cancer, but cancer chose them. And I dare say, sometimes I say cancer chose the wrong one, but I think cancer chose the right ones, because when you look at the work that is being done and the sophistication with which advocacy groups have mobilized to do this work, fewer names come to the top than Stephanie Walker. As a healthcare provider, as a patient, as an advocate, as one living with metastatic breast cancer and the lead on the Become Project, Stephanie is going to share with us her work, her motivation, what gets her up in the morning, and what empowers her to continue this work. So we're going to hear today from Stephanie Walker sharing the Become Project.
Thank you, everyone. It's good to be here, kind of like yeah. My name is Stephanie Walker. I am by trade a registered nurse. Retired now, living with metastatic breast cancer de novo for almost 7.5 years. Like Dr. Moe said, I didn't pick cancer. I would have picked something else. But since cancer picked me, we're going to go along with the ride. So I think they're going to utilize this clicker thingy for the slides back there, because I'm not multi-talented to do that, and chew gum too. So the Become Project essentially stands for the Black Experience in Clinical Trials and Opportunities for Meaningful Engagement. Next slide, please. This project came about this time 3 years ago in 2019, when I met another advocate named Marina Kaplan. She was presenting a poster at SABCS in conjunction with Living Beyond Breast Cancer. We had just finished up Hear My Voice, so we were Hear My Voice advocates there. So her poster there was called Increasing Participation in Clinical Trials and Patient-Driven Solutions. She did get to finish her phase 1 part of her survey that was identifying the barriers within the clinical trials, also seeking possible patient-driven solutions to reduce those barriers. She also thought about ways that could recommend solutions and strategies that would serve to support what we, the advocates, were already out there doing. But the problem that Marina had at that time was the Black participation, again, in a survey. There was only 8. I was one of those 8. So she came to me while we were sitting in the lounge, in the advocate lounge. Y'all need to check that out over at SABCS sometimes. The conversations that we had, she said, Stephanie, I don't know what I did wrong. I thought I hit everybody. And she said, do you think that you could present this survey in your community of Black people, not just with metastatic breast cancer, but with breast cancer in general? I thought that could be done. I had this. As a nurse, I thought the part of doing a survey is, you write down questions on a piece of paper, you put them on a copier, you pass them out, you get the answers, right? That's the truth. And she said, Stephanie, I'll do all the statistical analysis of everything that you get. I thought, man, winner, chicken dinner. So with that being done, unfortunately, when Marina was there at SABCS, actually Marina was in full liver failure. So before we could finish the project, Marina passed away. So with that being said, I knew what she wanted done, and there was another advocate that's not here knew what she asked me to do, and I said I would do it. But since the only 3 people and one was gone, nobody was going to tell on me if I didn't do it. So unbeknownst to me, in the spring of 2020, Living Beyond Breast Cancer, Janine came to me and asked me about that project. Damn. And I thought, I'm had. So she did. She came to me. She was a member of the Metastatic Breast Cancer Alliance and encouraged me to become an individual member of the Alliance to do that project. So spring of 2020, the project Become was born, actually. The Alliance picked it up right away and thought it would be great. Next slide, please. And this group here, the subcommittee of Become Amazing. This group was gathered together in the midst of the pandemic. I had not met many of them until this past June at ASCO, but this group here is the group that pushed Become beyond all means. I could not have done it without them working themselves and a few people out of their comfort zones. Miss Carla Harvey did a lot to push this out there. So next slide, please. The key inputs of this survey was done based with a literature review. We also did key informant interviews. We did extensive involvement of the Become survey that you guys seen there and their lived experiences, and not to mention the expert that the Alliance brought to the table along with C.B. White. The topics that we looked at were the demographics, the descriptors, experience with your oncology team, also the perceptions of clinical trials. We had a lot of those. Motivations to get us going, the barriers, support needs, and the information needs. When doing this, we did an in-depth qualitative interviews with a number of people. We did it with the patients. There were 13 Black metastatic breast cancer patients that were interviewed. Also, there was 8 clinicians, 4 hospital administrators, 4 breast cancer researchers, and also 2 payers. We had to get the money, you know, the insurance people have to get their comments on everything. So the considerations, we talked about the consideration, the barriers, the support, information, and the recruitment. After we talked to all of those people, the surveys were developed. The questions came from the interviews that were done with all of those, the informed group, also with the lived experience from the group, the subcommittee that actually, you know, have metastatic breast cancer, and also by the expertise from C.B. White and how she could formulate the questions to get the data that we believed we knew we needed to get. And with all of that being said, I set lofty goals for 500 respondents. I got close. I didn't get close to half and half, but I got enough Black respondents that were able to extrapolate the information that we needed for the results. We are not talking about the results here. We're going to, as the day progresses along, you're going to obviously get the picture of what the results were. And as has been said before, that if you give us the information, the opportunity, and ask the question, we will probably give you the answer that you're searching for, which is that yes. So if you would just give us the opportunity to have that dialogue and that conversation with you, the healthcare provider, or you, the nurse navigator, just to give us the opportunity to answer your questions. So if you want any more information on the Become project, you can find it on the blackwomenspeak.org, or you can go to mbcalliance.org and look up Become and find all the information there. Thank you.